So LUX-Lung 7 is phase 2 randomized study. It's a multi-center study which included common EGFR mutations, and this is the first study comparing head-to-head the two TKIs in untreated patients with non-small cell lung cancer. I think the study design is because this is the first head-to-head study, so that was interesting to see the two drugs. One is afatinib, which is irreversible EGFR inhibitor, and the other is gefitinib, which is reversible. So they have a different kind of mechanism, and we heard that although structurally they are similar in some ways, but there's some difference in mechanism to see if really there is a difference in these two agents, and especially the interest, at least for most of the oncology community, and to me was we saw in the LUX-Lung 3 and 6 where there was a certain subgroup of patients benefited more, especially with overall survival. Well, like I said, they have a different mechanism, and they, second generation TKI to first generation. So you could have picked erlotinib or gefitinib. So I don't know whether if you would have picked erlotinib versus gefitinib would have been much difference. I think especially if there's a question that one drug may be better than the other, specifically looking at certain subsets, then I think that's the only way to know. The take home is that definitely the afatinib is shown benefit in these response rates, time to treatment failure, and PFS compared to gefitinib, and especially there is no significant toxicity signal, which would be unexpected. So far we have been using afatinib definitely for deletion 19. Now I think that may be a little different than with this trial. You could pretty much use even for L858R.